Coast. And welcome to all who have joined us across the many virtual platforms like Facebook Live and YouTube. On behalf of Kappa Alpha Psi's Fraternity Incorporated's Military and Veterans Affairs Commission, affectionately known as MVAC, and Kappa's Health and Wellness Committee, in collaboration with the U.S. Department of Veteran Affairs and the All of Us Research Program from the National Institution of Health, I welcome you to our fireside mental health discussion. I'm E. McQuell Marshall with the U.S. Department of Veteran Affairs, Veterans Benefit Administration, and a proud member of Kappa Alpha Psi Fraternity Incorporated, and I will serve as your host and moderator for tonight's discussion. Now, did you know that post-traumatic stress disorder, or PTSD, is a mental health condition that is triggered by either experiencing or witnessing a traumatic event? Those suffering from PTSD may experience symptoms such as flashbacks, nightmares, severe anxiety, as well as uncontrollable thoughts about the event. While not everyone experiences or witnesses a traumatic event will develop PTSD, those who frequently do suffer in silence. So in recognition of May being Mental Health Awareness Month, we want to ensure that you are not suffering in silence. To kick off our fireside chat with a welcome and opening remarks, I would like to present to some and introduce to others the Grand Pole Mark, or International President of Kappa Alpha Psi Fraternity Incorporated, Mr. Reuben A. Shelton III, Esquire. Sir, the floor is yours.
Thank you, Brother Marshall. And I want to thank all of the Military and Veteran Affairs Commission members for conducting this critically important discussion. As Brother Marshall said, May is Mental Health Awareness Month, which has been observed in the United States since 1949. And this year's theme is Back to Basics. And the goal is to provide foundational knowledge and information that each of us can use to nurture our mental health. Now, we are delighted to have two outstanding experts in the field of mental health and suicide prevention. So I want to welcome Dr. Susan Black of the Veterans Affairs Department and a member of Delta Sigma Theta sorority. And also want to welcome our own Dr. Stephen Broughton, who is the chair of the fraternity's Health and Wellness Committee. And I give special thanks to the Department of Veterans Affairs and the All of Us Research Program from the National Institute of Health, as well as all others who had a hand in bringing this event together for the good of our fraternity, our local communities, and our great nation. Now, I ask that each of you go back to basics to be sure that you are confident about your own state, your own mental health, but also check on others in your communities to be sure they can avoid suffering in silence, as Brother Marshall said is the theme of our mental health discussion tonight. Now, I ask that you put your questions in the chat box to ensure that we respond to any questions or concerns that you might have. But finally, I have to recognize Brother Major General Hawthorne Pete Proctor. He is the chair of the MVAC. And I want to thank him for his relentless and untiring dedication to the causes of our military and our military veterans and servicemen. His passion for their causes is incomparable, and his love for our fraternity is just simply unmatched. So again, thank you all for attending this important session. And I'll now turn the program back over to Brother Marshall of the MVAC to begin the program.
Wow. Whenever, wherever, and however needed, sir, we thank you for spending a moment of your evening with us all and those watching across the globe. Much appreciated, sir.
Yes, sir. Thank you.
Now, to provide us with the purpose for celebration in our event tonight, I would like to introduce U.S. Army General, Major General, retired Hawthorne Proctor, who serves, as you heard earlier, the chairman of Kappa's Military and Veterans Affairs Commission. Sir, the floor is yours.
Thank you, Brother Marshall. Good evening, and let me thank you again for joining us tonight as you could be anywhere else, doing anything else, but you've chosen to sit by the virtual fireside and chat with us about a couple of topics of great concern: mental health and death by suicide. According to the National Institute of Mental Health, suffering in silence leads to depression and other mental health illnesses, which ultimately contribute to a high suicide rate in men because they often fail to seek help. This is the reason why CAPA's Military and Veterans Affairs Commission and the Health and Wellness Committee partnered with the U.S. Department of Veteran Affairs, the National Institutes of Health, All of Us research program to discuss available resources for anyone experiencing a mental health crisis and discourage the practice of suffering in silence. Mental Health Awareness Month doesn't have to be celebrated alone. Our new virtual environment allows us to multiply the amount of information and resources that we can share with you and others to increase awareness of mental health illness and to combat suicide. We don't want tonight to be a one-way discussion. We want you to post your questions, and we will relay as many questions as we can to our two distinguished panelists for a response. I'm looking forward to your participation, and I'll be back in a little later for some final thoughts. I will now turn the program back over to Brother Marshall.
Hey, wonderful words, Chairman Proctor. It's truly a privilege to serve our veterans, their family members, caregivers, and survivors, and any even greater privilege to do so alongside you. Now, to provide a clinical research view on tonight's topics in relation to the National Institutes of Health, All of Us Research Program, let me introduce Mr. Brian Oliver, who is the Assistant Kappa Alpha Psi Liaison to the All of Us Research Program. Mr. Oliver, the floor is yours.
Thank you, Mr. Marshall. I appreciate that. Before I talk a little bit about the All of Us Research Program, in the chat and comments will be a pre and post survey link. Just please take a quick minute to fill out those quick surveys on behalf of the All of Us Research Program. So the All of Us Research Program is a program sponsored by the National Institute of Health with the goal of seeking 1 million or more people from across the United States to volunteer for medical research. People who join will share information about their health, habits, and what it's like where they live. By looking for patterns, researchers will learn more about what affects people's health. At the moment, healthcare is often one size fits all. But imagine a future where your healthcare is tailored to you. The All of Us Research Program wants to help make that future possible. How? By creating a resource that allows researchers to conduct thousands of studies on health and disease. And that future is termed as the Precision Medicine Initiative, or PMI, which is an initiative created during the Obama administration that focuses on precise medicine for the individual. Think about what happens when you or a loved one goes to get eyeglasses. A series of tests are performed so that the doctor can prescribe a specific and precise prescription to bring your vision back to 2020. Well, the philosophy is that all medicine can be just as precise to treat the individual, but that can only be obtained through thorough and extensive research. To reach its goal, the All of Us Research Program is partnering with leading institutions, organizations, community partners, and participant representatives across the country. Historically, this type of research has been predominantly done on middle-aged white males and females. The African-American population makes up 6% of the research. It's even less in the Latino communities. Since we are severely underrepresented in this category, the All of Us Research Program has made strides to educate and engage our communities about these programs and initiatives. A better understanding of the genetic, physical, mental, and emotional issues that plague our communities can only lead to more effective treatments and possibly cures. Please consider joining all of us. You can go to www.joinallofus.org for more information and to participate in the program. Again, that website is www.joinallofus.org. And also, please remember to fill out the post survey, a link that is in the comments. And thank you for your time. And I turn it back to Mr. Marshall.
Hey, That was great insight, Mr. Oliver, and I'm glad you were able to provide our audience with some insight into what NIH does and how the All of Us research program is making strides to increase awareness to clinical research on mental health awareness and help assist to eliminate the death by suicide rate. Thank you. Next, I'm excited to bring to the stage the two distinguished panelists that you heard our Grand Pole Mark talk about a little bit earlier to give us insight into mental health and suicide prevention. First, Dr. Stephen Broughton, a practicing psychiatrist and the current medical director at Southeast Arkansas Behavioral Healthcare System, Incorporated. He's also a deputy sheriff working with the Arkansas Jefferson County Sheriff's Department and working directly with law enforcement for acute stress management and post-traumatic stress disorder. And as mentioned earlier, the national chairman for Kappa Alpha Psi Fraternity Health and Wellness Committee. And before I turn it over to Dr. Broughton, I'll go ahead and give you a brief intro of Dr. Susan Black as well, and she can follow Dr. Broughton. So Dr. Susan Black is VA's Veterans Benefit Administration National Suicide Prevention Officer within the Outreach, Transition, and Economic Development. Dr. Black is a retired United States Air Force Clinical Social Work Officer, where she held various clinical and leadership positions to include Chief of the Air Force Wounded Warrior Program, Information Manager for the Office of the Assistant Secretary of Defense, and Social Work Residency Training Director. She was also deployed in support of Operation Enduring Freedom and is a proud member of Delta Sigma Theta. Dr. Broughton, I'll turn it over to you.
Thank you, Brother Marshall. It is indeed a pleasure to once again present a topic of vital importance to the African American community and to our veterans community. I want to personally thank Brother Grand Pole Mark Reuben Shelton for his leadership and vision in making mental health education, awareness, and treatment part of his core programs. And thank Brother Proctor for involving the Veterans Association with this significant topic. I also want to thank All of Us Research Program for the opportunity to educate our communities on certain aspects of mental health. This is one of the most important issues in our communities at this time. Brother Marshall? Brother Marshall?
Yes, sir. Thank you for that. And the information that you're sharing is very moving and touching. And we hope that the information that we're giving out tonight is reaching those individuals who are out there. We know some of you are experiencing major depression and you are looking for some healing, some information, and some resources. So Dr. Broughton and Dr. Black will be here to provide that to you tonight and get you the assistance that you need. So without further ado, Dr. Black.
And good evening to the Grand Pole March, Reuben Shelton, General Proctor, Dr. Broughton, and the Brothers of Kappa Alpha Psi Fraternity Incorporated. Thank you for the opportunity to discuss a very important topic this evening. And thanks to all of you who are taking the time out of your schedules to join us. When discussing mental health and mental illness, suicide prevention should always be discussed, as assessing for risk is paramount when faced with mental health challenges. Suicide is an intense topic for some people, so during our chat tonight, if you need to take a break or step out, please do so. If you need some immediate resources, the National Suicide Prevention Lifeline Number is 1-800-273-8255. And I think we'll have that number posted in a few minutes. If you are a service member or veteran, just press 1 to connect with the Veteran Crisis Line. But we know that this is a very important topic, and sometimes some of the discussion that we'll have, may get you to a point where it could be intense. So prior to COVID-19 pandemic, suicide was the 10th leading cause of death in the U.S. In 2019, there were 45,861 adult Americans died by suicide. Of those, 6,261 were veterans. Now, these numbers are more than just statistics. They reflect individual lives ended before their full stories were written. Data from our VA's 2021 annual suicide prevention report shows that veteran suicide, for the adjusted rates, are at 1.5 times higher than of non-veterans. So with this disproportionate rate of veteran suicide, VA's top clinical priority is preventing suicide among veterans. Suicide is a national public health concern that affects all Americans, including veterans, their families, and their friends. And as such, VA is a leading advocate in suicide prevention, looking at both clinical and community-based interventions. Now, COVID-19 pandemic has placed a lot of additional strain on our nation and on individuals and communities. So we understand that, coming in, that there is a lot that's going on in the area of mental health, and making sure that we're taking care of ourselves in those challenges. But when you're talking about suicide is a complex issue with no single cause. There is no single cause of suicide. Suicide is often the result of a complex interaction of risk and protective factors at the individual, community, and societal levels. Risk factors are those characteristics that are associated with an increased likelihood of suicidal behaviors. And those protective factors can help offset those risk factors. So to prevent veteran suicide and to prevent suicide in general, we must maximize those protective factors while minimizing those risk factors at all levels throughout the communities nationwide. I hope that this webinar can not only bring awareness to these important issues, but also equip you with the tools you need to save lives that might otherwise be lost to suicide. You can save lives by being sensitive to people in distress and by connecting them with care. I look forward to the discussion tonight. Thank you.
Hey, thank you for that opening, Dr. Black. And you said something that was very touching, because when you think about all the problems that we had prior to the pandemic, and now you multiply that by adding on with the pandemic, it really has drawn folks to a brink of not knowing what to do and where to go. So if you're in that space, we're here for you tonight. And if something that is said may not be for you, but we ask that you take it back to others that you know, family members, your fraternity or sorority members, or even your coworkers, because you never know what little piece of information that you have may do to help stop someone from harming themselves. So I'll jump right in, Dr. Broughton, because I've been wanting to ask you this question all night. What exactly are we talking about when we say mental illness?
That's a very good question, Brother Marshall. Breaking it down from the very start, mental illnesses are conditions that affect the brain. They can cause changes in the way people feel, think, and act. They're pretty common. Each year, 1 in 4 adults in the United States is affected by mental illness. People with untreated mental illnesses may have a hard time coping with everyday life and may also feel physically ill. It can happen to anyone. It affects all ages and backgrounds. No one really knows what the exact cause of mental illness is. Family history, such as genetics, predispositions, brain chemistry, or very stressful and traumatic events may all be factors that cause certain types of mental illnesses. But when we're talking about suicide, as Dr. Black was speaking specifically of, we're talking about mostly mood disorders, mostly. Depression is what people hear the most, and depression has caused more suicide attempts than just about any other mental illnesses. Depression severely affects how you feel. It can happen to children, teenagers, and adults. It affects a person's health, school, work, and family life. It even affects their eating and sleeping habits. It brings severe and long-lasting feelings of sadness, and it can cause a person to feel like life is not worth living. Sometimes depression is accompanied by resultant drug and alcohol abuse, when people try to self-medicate and find a way not to feel as bad as they feel. But it can also occur with other long-term types of health problems as well. There are certain factors that we generally talk about that are typical of people who are become suicidal. And I usually categorize them in terms of 4 different things. One is feelings, one is thoughts, one is physical effects, and one is spiritual beliefs. When we talk about feelings, you'll note that people start acting or different, and you notice that they've become more irritable. They have resentment, they have anxiety and fear, they have despair, hopelessness, guilt, sadness, helplessness, or lost control of what they are involved in, and a disinterest in things that they normally feel interested in. They feel quite overwhelmed at times. When we talk about thoughts, they have difficulty concentrating or thinking, difficulty making decisions, forgetfulness, confusion, distortion of sense and time, lowered self-esteem, self-blame, intrusive thoughts and memories and flashbacks of things that were traumatizing, worry, a sense of being cut off from reality, and thoughts of self-harm starts sneaking into their mindset. Physical effects, they become easily fatigued, they have difficulty sleeping, their appetite may either increase or decrease. They have a lot of physical complaints, mostly with headaches or stomach problems of some sort. Decreased or increased sex drive. They're easily startled. They have increased cravings for various things, types of food, alcohol, other substances, and they feel weak. When we talk about spiritual beliefs, we talk about they have a change in their relationship or belief in a higher being or God. They abandon things that have been a part of their life, such as prayer, rituals, scriptures, devotions, sacraments. They struggle with the question of what's the meaning of life? What is fair? What is justice? Is there really an afterlife? They question their own faith significantly. They reject spiritual care providers. Their feelings and expressions of gratitude and appreciation for divine intervention is not there any longer. And they have other types of rituals that they start adhering to at that time. So this gets really pretty significant.
Yeah, I see, Dr. Broughton, and you really touched on something that a lot of the behaviors change in individuals, and that really says something, because when someone is not the normal person that you used to, or that or that you're around, we see some of those signs. So before I ask you my next question, Dr. Black, we actually got notified that someone is suffering through depression and feeling suicidal. What should that individual do right now, Dr. Black?
So right now I thought we had the suicide prevention hotline number that's on there. I would ask that person to call that number
Immediately, right, Dr. Black?
right now.
So please, if you are experiencing depression or you're having suicidal thoughts, please contact that number, 1-800-273-8255.
And if you don't feel safe, go to the nearest emergency room immediately.
Right.
Present yourself to someplace that can get you immediate help immediately, where you will be safe and feel safe.
Yes. and
Yes.
and let someone know that's in the house with you, or a family or a loved one, that
Indeed.
you're having these feelings.
Indeed.
So definitely. Uh, Another question for you, Dr. Black, that one of our viewers has. What are the protective items that you mentioned?
And that is a good question. I think Dr. Broughton talked a lot about some of those risk factors and some of those warning signs um, that we have to look at when you're looking at suicide. But when you talk about protective factors are those things that can help offset those risk factors. And these are characteristics that are associated with the decreased likelihood of suicidal behaviors. And some of those protective factors for suicide include access to mental health care. So dialing 911, presenting yourself to the emergency room if you're having those feelings, or seeing your family practice, just having that access to mental health care, feeling connected with other people is a protective factor. We talk about to connect to protect. And so having those connections, those individuals that you can talk to, where you feel connected to others is so important. Having positive coping skills um, is also a protective factor. Being able to cope through problems and being able to process any of the problems that you have, and to be able to realize that staying in the present moment when you're trying to cope with problems, and realizing that I'm here in this present moment. This too shall pass, and to continue on. Having that sense of spirituality, I think Dr. Broughton mentioned that. The big protective factor is spirituality, cultural beliefs against suicide is one of them. Having a mission or purpose, is a protective factor. Physical health, the things you need to do to be physically healthy is a protective factor. Or as I said, having that access to that medical and mental health care, being employed, and having that social and emotional well-being. And these are all things that we consider as protective factors against suicide.
Yeah, definitely, Dr. Black, and I think part of the theme that I continue to hear from you and Dr. Broughton is a support system, individuals around you, and being able to be open and share. Would you both say that building a network amongst brothers or sisters, or close friends and colleagues, to challenge each other, to stick by each other, and to recognize signs of someone just not well, or someone who isn't part of your group, that isn't their normal selves? Would that help?
So I could tell you, we talk about a network of support in the VA, and trying to build that network of support, and working very dedicated for a lot of military members when they come in, to have that network of support where they have individuals who get some of the same information that we give to military members and veterans. So that we know that is very important. When you're talking about suicide prevention and having those protective factors, having that network around you of those individuals who are non-judgmental, who understand you, makes a big difference when it comes to, having the support you need when you are going through challenges.
Yeah, indeed, I concur totally with that. As one of the 34th administration's main things is brother to brother, building breaking barriers, building bridges. I say it all the time. I follow up by saying, I am my brother's keeper. And one of the things we did when we were socially isolated during the pandemic was making sure that you call everybody that you have a relationship with. It's so important to talk on a regular basis with people, because you get an understanding of their stressors, their level of feeling overwhelmed and stuff, by just small conversations on a daily basis, or on a weekly basis even. We believed in calling all brothers and checking on them no matter what. You never know what somebody is going through unless they tell you. So therefore, it's important to have conversations with them regularly, because most people that are struggling, they will be honest. they usually are pretty honest. You rarely have that many people that are dishonest about how bad they feel.
Mhm.
So it's important to keep those lines of communication open on a regular basis, and communicating with just even a phone call on a regular basis helps a lot of people.
Yeah, and you remind me, Dr. Broughton, of a conversation that Dr. Black and I had. You don't know what you don't know. So, if you don't know that someone is going through something or they're having issues or problems, you may tend to think that their life is peachy and, cream. But, as Dr. Black and I were talking about, you go through a pandemic, for 2 years, you really don't see, your normal fraternity members or sorority members at those normal chapter meetings, your normal coworkers that you went from seeing every day to not seeing at all except on a Zoom call or during conversation. It can take a toll on you.
It really can, and you have to start observing their behaviors. Excuse me. One of the things that I talked about before was certain things you notice, but the behaviors that start changing are crying spells for no reason, angry outbursts, being argumentative about things that they're not normally argumentative about, avoiding people in places and situations. They're not wanting to leave the house. Now that we can leave the house a little bit more than we could previously, but they don't want to go anywhere. They don't want to do anything. Risky behaviors such as, excuse me, risky behaviors such as driving erratically,
Mhm.
having a lot of sexual partners, participating in activities they normally wouldn't participate in, increased gambling, other types of risky behaviors. And then the one thing that's really obvious is inattention to their personal appearance, their personal hygiene and self-care. You know, uh, as Kappa brothers, we all like to look good. All of a sudden, his brother doesn't care. He's not wearing the clothes. He's a sharp dresser. He's not wearing those clothes that he used to wear. He's not paying attention to his grooming at all, and he's not bathing. Those are behaviors that are quite different and are noticeable, and that's where you should start considering some type of intervention.
Thank you. So Dr. Broughton, we had a question from Kirk Wilkerson, who was speaking of the those signs that you spoke about. What do you do when you can't convince someone, or they just don't want to get help, or they're in denial? What do you do? How do you combat that?
Well, and I'm gonna let Dr. Black speak on it specifically, because one of the things that as a practicing psychiatrist, I don't see those people first. They don't want to come to a psychiatrist first because they don't want to be perceived as crazy or something like that. So they usually will go to a friend, or they might even go to their pastor or somebody, or their primary care doctor. Primary care physicians are as important as anybody because they see people way before a psychiatrist would see them. But when as a layperson, if you see somebody, I tell people there are certain things you should do. One, avoid the stigma. Keep things as simple as possible. Don't judge, just help. Listen, be attentive, and be supportive. Don't try to tell them what they have or make a diagnosis, because if you're not a professional, that's going to do very little. That's going to help very little and probably cause more problems than not. Talk about other things and point out things that may be similar to their situation, because some people would rather talk about someone else's problems more so than themselves, and they can kind of relate to those things, but be supportive in conversations like that. And finally, if you're going to make a referral initially, you know, let them consider talking to their primary care doctor or their pastor. Don't say you need to go see a psychiatrist, because usually that's pretty significant, and that turns a lot of people off. And you're trying to get them someplace. Now, if they are acutely depressed and saying they're suicidal, then you need to either encourage them to come with you and go to the nearest emergency room, or you need to call and get help. And that means call whatever emergency services are required, such as the fire department, police department, or what, and be there for them as they come to assist. Because the ultimate thing is you want to prevent a tragedy. And when you get to a certain level, then obviously you have to do what is going to be safest for the person, rather than what you think you need to do.
And great point, Dr. Broad, and you got to what I wanted you to make a point of, preventing that tragedy. So, Dr. Black, what do you say to a person that's in denial? How do you push them a little bit further to get them to recognize that they need help?
And so that is a very good question. When you're working with someone, a lot of it has to do with, in VA, we talk about the SAVE training. First of all, identifying what are those signs. I know what the signs are. I identified that I have a friend that has a problem. And then to just be frank, ask that question. Are you thinking about killing yourself? You have to ask that question, and then ask it in a way where you're looking open for an open answer, not trying to discourage them by saying you're not thinking about killing yourself, but ask, are you thinking about, because you already have those signs. So, one of the ways of engaging that individual is to say, hey, I understand that you're going through a lot right now. And oftentimes when someone is going through some of the things you're going through, they may be thinking about like killing themselves through suicide. Are you having those thoughts? And then once you have that, you have to validate. You have to listen, and that's a part where you become a listener, and listen to what they're saying. Be open-minded, and then what I tell people is, help them, escort them. I will help you. We need to get help. I will take you. I will walk with you. I'll make that phone call with you. We'll sit here right now, and I'll call the Suicide Prevention Lifeline with you right now. So sometimes you have to, take their hand and guide. But, as Dr. Broughton mentioned, when you're looking at some of those risk factors, those warning signs, that has been there. I mean, this person has been screaming and crying that there is a problem and been waiting for someone to notice that. And so noticing that, and then being understanding, empathetic, and compassionate, and listening to them, not judgmental, and just listening to what's going on. And then we like to encourage them to seek help. And sometimes you have to say, I'll go with you. I'll make the appointment with you, and I'll go with you. Sometimes that's the extra push that's needed, because we talked about that connection. We talked about that support that you need. So having that support network, having that connection, helping someone to make that decision, and letting them know that, hey, I know there's a lot going on, and there may not be a quick solution, but there is help. Help is available. I'm here with you. I'll take you. I'll walk with you. I'll make that phone call with you. I'll show up in that appointment, and then continue to show up for them. And, when they get that help.
Wow. And Dr. Black, this is why I like conversations with you, because you keep it real. So, just flat out ask them, are they looking to harm themselves or to kill themselves? Just flat out, to get it out there.
Right. And use the word kill.
Okay.
Because harm could mean something differently.
Okay.
You want to ask that question.
Okay. And see, and I still didn't want to say the word, but I'm glad you are giving us, this advice and this information.
And that's good that you said that, because a lot of people have a hard time asking that question. That's a difficult question to ask. And we know, I mean, Dr. Brown and I know that there's that stigma that's associated with mental health, but that's the hard question to ask. And that's the one question you can't beat around the bush. You have to be direct and ask that direct question. Are you thinking about killing yourself? Are you thinking about killing yourself? I know that you're having a difficult time. Are you thinking about that? And then let me get you some help.
Dr. Black definitely, she nailed it on that. That, like I said before, most of these people, and I say just about all of them, are very honest. At this point in time, they're very honest. And you do have to ask the question specifically, do you want to kill yourself? Because that's a very direct question, and it goes to the exact point of what you're trying to prevent. And I never will forget, as a resident training at University of Alabama, Birmingham's Medical Center emergency room, I asked the guy in the emergency room if he was feeling suicidal and did he want to kill himself. And he said he did. And I said, how would you kill yourself? And he said, with this gun. He gave me a gun in the emergency room. So you do have to be very direct when you want a real answer.
Yeah, that definitely is good to hear, and I'm glad that our audience is getting to hear. Be direct and ask those questions. So, what would you say? And this is probably one of those myths, and I was going to get to some myths later, but I feel it's important now that one of our viewers feels discouraged from seeking help because they feel like people view it as attention seeking. What do you say to that? And I think I already know the answer, but I want one of you doctors, the professionals, to tell the audience.
I mean, I would tell them to seek help. That is a myth that someone that needs help is, seeking attention. We consider everything serious. If you're having some thoughts of harming yourself, if you're under distress, seek help. Just seek help. Your provider is not going to think that you're just seeking attention when you go to see them. So, I encourage you to just seek that help. Whether it's with your family, your practice provider, mental health provider, but seek help, because mental health providers, we don't think that is attention seeking. We think it's a cry for help, and we commend you for having the courage to seek help, because we know that it can be difficult seeking help, and help seeking is a sign of strength. So we applaud you for wanting to seek that help.
Great point. Next question that came in was from Mr. Hollis Thomas. And I want to read this because it is very important. He says, historically, men are socially constipated when it comes to topics like mental health, prostate exams, and marital problems. What advice can you both give to offer help for men to develop that safe bubble of friends that they can be transparent with? I know we touched on this a little bit earlier, but what advice would you give? And I'll start with Dr. Broughton and allow you to follow up as well, Dr. Black.
Well, everybody that knows me knows that I'm very direct.
Yes.
And one of the things that I would tell them is, it's time to accept grown thoughts. And I say grown thoughts when I say men have been taught for many, many, many moons to not cry. They've been taught that big boys don't cry, big boys are this and that, and they wouldn't go to a doctor or emergency room until they about to die. And that is why men don't live as long as women because women are so much smarter than us. You have to start accepting some responsibility that you have feelings, you have a brain, you have thoughts, you have physical health and mental health that is in some instances just as fragile or more fragile than your wives, sisters, and mothers. So you have to have some grown thoughts and accept responsibility for your own health. It's time for us to start accepting responsibility for our own health. One of the proudest things I am in this fraternity is the fact that we decided to make mental health education and treatment a reality, because it's been there for years, and we've just ignored it. We've pushed it to the back of anything that's real, and we've suffered the most for it as a community.
Thank you for that, Dr. Black. Anything in your eyesight for men and also for women who may not have that bubble of friends that they can be transparent with?
Right. And I think that is, I think Dr. Broughton hit it. It's socialization, how men are socialized to believe that, I'm tough. I mean, we see that in our veteran population. We see it in the military, right? We continue to fight. It's mission first. It's mission always. And so you see that. And so we see help seeking sometimes as a sign of weakness. But changing that narrative and saying, hey, it takes courage to seek help because like I said earlier, the stigma that's associated with it. So, help seeking, is that sign of strength. But I tell you what we're noticing now, because now we're into these intergenerationals, and the millennials are a little different in population as far as being able to tell you and to be able to verbalize that. It's a little different. So we're seeing some changes. When you look at the data, the American Psychological Association looked at the stress during COVID, and they did look at millennials. They were more apt to tell you that we're dealing with more psychological health issues. We're dealing with more stress. So that may change to some point, but it is about as Dr. Brown said, about just being accountable and understanding that it is okay to seek help. It is okay. I mean, we've been through a pandemic for the last 2 years. This is a perfect time for because all of us are stressed. Perfect time that all of us should be seeking help through our family practice doc and talking about some of the stress that we're dealing with, because that's something that's normal. I know that in the military, Department of Defense, they started doing what we call annual mental health assessments for that purpose, so that if everyone is getting it, then it's not, the stigma is not there. You don't have that, where you're seeing mental health. So, getting to a point where you're taking your physicals and you're having your doctor to check that mental health. You're doing your mental health check as well. We say mental health is health. It's all health. It's all a part of being healthy. So I think, when you're seeking that medical health, also seek mental health as well.
Thank you for that. And you actually segued into my next question, and I want to bring Major General Proctor back to the stage and ask. I noticed that we have a few active duty members who have joined us tonight. So I'd like to briefly shift gears from veterans and ask you, sir, do you have any insight on what else DOD is doing in the area of suicide prevention?
Great question, Mr. Marshall, but I can't even come close to the experts that you have on station here. But I just wanted to share a few points with the audience, and that is DOD established the Suicide Prevention Office in 2011. Its focus is on improving mental health for those who are serving as well as their families. Now, of significance is the collaborative working environment that you've heard our two guest speakers talk about tonight. And theirs are with the Department of Veteran Affairs, Health and Human Services, and within the Defense Health community. Also, DOD sees its community-based entities such as military leaders, family members, peers, spouses, chaplains, as well as their clinical care staff to address suicide thoughts and behaviors at the individual level. So this is kind of like a community affair and not just one set group. But tragically, DOD lost 584 individuals to suicide in 2020. And that number also high dropped to 518 in 2021. So I would say this, and I'm not doing justice to this topic because it's more pervasive, but I just want to focus on the efforts of these 7 strategies. There are 7 strategies to improve mental health, to help reduce suicide, but I want to focus the time we have left on 2 prominent ones. And that is creating protective environments by securing such things as guns, ammunition, and medicines. And many of you know that a lot of people who are serving do own their personal firearms. And this is one way we can just make sure that they are not readily accessible. There's another area in the medical side, and that has to do with pharmacogenetics, which looks at what the tendencies are for individuals who are on medication, what happens when they come off that medication. And I know of a personal case involving a young man who was out of the Army, fell in love, and he was on medication. His dad believes he quit taking the medication when he and his fiance broke up later to take his own life. So creating that protective environment certainly may reduce the incidence of suicide. And the second one I want to talk about was promoting connectedness, which is part of our discussion today. Don't let our friends, relatives, and others, be in silence and suffer in silence, which is our major point. And that is DOD's interest on interpersonal connections to family and friends, which they consider absolutely critical. But they also ask that we pay close attention to our colleagues, our friends, and family, and speak up if we observe changes in their behavior, which you heard earlier tonight. So let me stop on that note, and maybe there's other questions that people may have in the chat box.
All right. Thank you so much for that. As I pull another question, quick myth buster here, Dr. Brodden. Is it true that the only people that can help someone who is suicidal are mental health counselors and therapists? Dr. Brodden?
I was trying to get my mute button off. That's not who they're going to come to first. They're going to come to friends first. Friends are going to notice how their behavior and everything else is changing first. So the most important people are the people that are around them the most. Those are going to be the people who initially will see that something is changing.
Great. Thank you. So we have another question from Andre Murray. For someone who is suffering from acute depression, are there risks associated with asking such a triggering question? Dr. Brodden?
I don't think so. Any question you ask, most people are gonna, if depending on your relationship with them, but
I think we've lost Dr. Brodden. So while we get our next question up, Dr. Black, I'll ask you, another mythbuster. Talking about suicide from someone in distress leads to or encourages them to die by suicide. Is that true?
So that is a myth. The reality of it is that if you looked at some of those risk factors and some of those warning signs that Dr. Broughton talked about earlier, that type of person should not go unnoticed. If you have a person who's not sleeping, they're not eating, they're irritable, they're not taking care of their dress and appearance, that person does not go unnoticed. So asking that person is not going to give them that idea. They already have that idea. Asking will give them the opportunity to say, hey, I'm glad you noticed me, because that person should be noticed. That when you have a difference in behavior and you have difference in mood, that is noticeable. And oftentimes many of us just ignore it and like, oh, we'll leave this person alone, for a minute. We'll just let them go in the corner. But the reality is that's when we need to connect. That's when we need to ask that question, because that individual, as I said, they have been screaming, listen, look at all these things that's going on in my life. Look at how I'm behaving. Look at how I'm talking. Look at how I'm acting. So you're not going to give them that idea. It's already there.
Thank you. So I'll pose the same question that Dr. Broughton was asking or answering to you, Dr. Black. For someone with acute depression, are there the risks associated with asking, such a triggering question?
There's not a triggering question if you're asking someone, as I said before, with empathy and general concern.
Mm-hmm.
There's not a lot of triggering questions if you're asking now, but it's the way you approach them. If you're approaching that individual in a way where you're saying, where you're not depressed, snap out of it, which unfortunately sometimes is what a lot of us do, because we don't understand mental health. We don't understand mental illness. But if someone who is acutely depressed, telling them to snap out of it isn't something that should be said. Like I said, it's having that compassion, that understanding, and for that individual who has someone in their lives that may be acutely depressed, it's getting that information as well. It's learning about what is depression, what does that look like, what are some of the things that this individual has that makes a difference.
Thank you. So, what advice can you give African American men who are trying to lead their families while witnessing the blatant murder of their family members? And what advice can you give to African American military veterans in the community at large who may be on the brink of major depression or even worse, suicide? Witnessing the attempted annihilation of Blacks. And that question came from Mr. Paul Montgomery.
And I think just acknowledging the fact that there is a lot happening, with the pandemic, with civil unrest, we have just seen a lot in the last 2 years. And so, what we tell people is that resiliency, doing the things that you need to do to take care of yourself, practicing some type of mindfulness or meditation. This is a time that whatever your beliefs are, whatever it is that you take for solace, this is the time to really practice self-care and to look at that. And in some cases, it may be time to see your family practice doc or actually see someone, a mental health counselor. Understanding that for a lot of people, they may be experiencing some trauma. We've seen a lot. So there's a lot of, I think, some symptoms of trauma that a lot of us are dealing with at this particular point. And so just getting that help and seeing someone, whether it's your pastor, whether it's a good friend that you have, and having these conversations. And as I say, just building that self-care and that resiliency is going to be very important at this particular point in time.
Thank you for that. And as we're nearing the end of our discussion, Dr. Black, I'd like to ask, what are some resources that are available to anyone who is in distress or feeling suicidal, and resources for family members who are left behind? Because I know we often talk about the individual who has died by suicide, but the family members that are left to pick up the pieces, They need resources as well.
Well, and I think that the suicide prevention lifeline, that one number we gave earlier, the 1-800-273-8255, that is going to be so important. That if you're having some problems, you having any thoughts, call that number. That number is available 24 hours a day. They have counselors that are there that'll listen to you. And this is if you're in distress. I mean, you don't even, not necessarily if you're suicidal at the time, if you're even in distress, call that number. There's a lot happening with that number, and in the next several months, they're going to make it real easier for individuals to call. That 1-800-273-8255 will end up being a 988 number in July. The mid-July, you'll have that. So it'll make it a lot easier to get that help. Mental health, if you want some mental health resources, the VA has a lot of resources, and you don't have to be a veteran to get some of these resources. The mentalhealth.gov, mentalhealthva.gov site is a good site, just abundance of resources. There are mobile apps out there that are free. They're free. As I said, VA is a leading advocate when it comes to suicide prevention, not just for veteran population, but for the public health at large. So a lot of good information. We have a keepitsecure.net. I think General Proctor talked a lot about lethal means and lethal means safety. So there's a lot out there. You'll probably start seeing a lot on lethal means safety, locking up those firearms. We know that in 70% of suicides for veteran, it's hard because it's like you can't tell you why, but we know how. And it's normally 70% is with a firearm. And so little things like, locking your firearms, getting that time and space in between the thought and action. And sometimes, locking up that firearm is giving us that extra time that we need for a person to say, hey, for a phone to ring, for something else to happen, for them to change their mind. So a lot of, just a lot of good resources. There is a VA PTSD, va.gov, a lot of great information on that website as well. And I know Dr. Broughton has a lot of other resources.
Yes, I'm glad I'm back. Well, obviously, like I said, the main resource is is your primary care physician, who will see you before just about anybody else. But friends, obviously, pastoral services. You have a lot of ministers that do accept mental health care as something that's vitally important for their communities, and they don't talk against it. Some will try to pray the mental illness out of you, and those I have a little problem with. But majority of I call what the good ones understand that this is a needed source of help for a number of people, and they have made some excellent referrals from people in their congregations that they felt needed help. We have a significant community mental health system in the state of Arkansas, and that it has become similar to a lot of states also that has community mental health centers where you can go and seek help from a therapist or have somebody to talk to that will check on you and get you started in the treatment. There's Substance Abuse and Mental Health Services Administration, which has a helpline. Excuse me. Then the Health Resources and Services Administration. Excuse me, I just have a cough I can't get rid of. Then there's also other professional organizations such as National Alliance of Mental Illness, Mental Health America, Depression and Bipolar Support Alliance, Anxiety and Depression Association of America. State and county agencies also provide good points of access. So there are a number of places that you can go for information on how to get mental health treatment started.
Thank you for that, Dr. Brodden. And I believe it was Mr. Joseph Richardson who's been communicating with us, Dr. Brodden. We'd like for you to offer any resources available to him, or if he can contact you. I think that'll be a great help to him, so that we can get those resources. And I believe he can inbox us contact information so that we can reach out to him. So, and, the night could go on forever for me, but I know that we must come to a close. As I always say, it's not outreach if we aren't reaching out. And that's what, on the VA side, VBA, Outreach, Transition, Economic Development, we will continue to do any opportunity we get to collaborate and partner with organizations such as CAPA's, MVAC, Health and Wellness Committee, All of Us Research, or anyone else who is out there. That is what we do. And, for any veterans who are listening, if you're interested in learning more about benefits and services, please visit www.va.gov. That's www.va.gov, or contact us at the 1-800-827-1000, because we know a lot of depression and stress and things come from finances and the lack thereof. So, benefits and services that are available to those veterans can be researched there on our website. And as I mentioned, I want to say what a wonderful evening we had. Thank you to our two distinguished panelists, as well as General Proctor. And I'll leave you with this. I want to challenge each and every one of you this evening to do more tomorrow for a veteran than you did today. So now, to deliver our closing remarks, I'd like to bring back Major General Retired Hawthorne Proctor, MVAC Chairman for Kappa Alpha Psi. Chairman Proctor, the floor is yours.
Thank you, Mr. Marshall. Wow, this has truly been an enlightening discussion, and I've learned a lot. I certainly hope you can say the same. We had some truly wonderful questions come in from our audience, and we would be remiss if we didn't say thank you to our two subject matter experts, Dr. Susan Black and Dr. Stephen Broughton. Thank you both for your wonderful discussion and your chat openly, freely, and extensively with our audience. Additionally, I want to take a few minutes to thank our Grand Polemarch, Mr. Reuben A. Shelton III, Esquire. Can't find another supporter and leader with such commitment to taking care of all of us. I'd like to thank Mr. Brian Oliver for joining us tonight as well. Talk about all of us. And our moderator, Mr. Marshall, and behind the scenes, Mr. Antonio Martez and Mr. Noah Lucas. Some of the things that were emphasized in tonight's Fireside Chat will stick with me, and I hope you will use this knowledge and resources to assist someone that you may feel is suffering from mental stresses and who may have thoughts of harming themselves and or others. Finally, I want to thank all the veterans and their family members who joined us today, as well as others who may not have worn the uniform, but are serving our veterans. Please have a great evening. Be safe. Just remember, as Dr. Broughton said, we are our brothers and sisters keepers. And the good book also says to love your neighbor as yourselves. So let's take care of each other. Let's not let anyone suffer in silence. Again, thank you for your time. and for joining us tonight.